Hello everyone and welcome to the Gold Medal Nursing Channel. Recently I've cared for 3 patients with aortic dissection and 1 who had heart valve replacement surgery. They were all around 55 years old. Honestly, it feels like these conditions are affecting younger and younger people. So today I want to talk about ways to take care of your heart and why it's so important. Aortic dissection and mitral valve prolapse sound scary, but if you understand the causes and live a healthy lifestyle, you can live a good long life. We'll also talk about the power of sleep, traditional Chinese medicine, the benefits of Tai Chi, the effects of magnet therapy, and even how to manage your desires. Ready? Let's go! First, let's talk about aortic dissection. This is when the inner layer of your main artery tears and blood flows into the wrong places. In serious cases, the artery can burst. Why does this happen? Number 1, high blood pressure. High blood pressure is like a water pipe about to explode. The artery wall can't handle the pressure and tears. Number 2, some people are born with it, like those with Marfan syndrome. Their artery walls are as fragile as paper. Also, things like hardening of the arteries, injuries from car accidents, or a family history of the condition can increase your risk. Additionally, pregnancy, drug use, or extreme exercise can also put too much stress on your blood vessels. So if you have high blood pressure, don't ignore it. Next, let's talk about mitral valve prolapse. Simply put, it's when the mitral valve in your heart doesn't close tightly. It's like a crooked door, leaking blood backward when your heart beats. Why does this happen? It's mostly genetic, especially for people with connective tissue problems. Also, as we age, the valve can wear out and become loose, like a rubber band losing its stretch. Or if you've had heart inflammation or heart muscle problems, it can also weaken the valve. This condition isn't always immediately life-threatening, but it needs careful attention. The patients I've seen recently are all around 55, still relatively young and strong. But why are they getting these conditions? From what I've observed, their lifestyles are chaotic. They don't get enough sleep, they stay up late and sleep at the wrong times. Over time, this drains their energy and spirit, and you can see it in their faces. Plus, they tend to have short tempers, which directly harms the heart. I really think cultivating inner peace is super important. Haha, I'm getting off topic. Let's continue. Whether it's aortic dissection or mitral valve prolapse, recovering well after surgery is key. Let's take it step by step. After surgery, you need regular checkups like echocardiograms and CT scans to see how your blood vessels and valves are doing. You must take your medications as prescribed, such as blood pressure medicine and blood thinners, especially for those who've had valve replacement. You might even need antibiotics before brushing your teeth to prevent infection. As for your diet, less salt, less oil, more vegetables, more soup. Don't overwork your heart. For exercise, avoid strenuous activities like weightlifting. Walking, light stretching, these are good. Good blood flow makes a happy heart. Speaking of heart health, sleep is a superhero. Get 7 to 8 hours of sleep every day, preferably at a fixed time like 10 at night to 6 in the morning. Why? Poor sleep messes with your stress hormones, which then affects your blood pressure and heart rate. Your body is weak after surgery, and good sleep is essential for recovery. Keep your room dark and quiet. Don't stay up late on your phone, and limit your coffee intake. Traditional Chinese medicine talks about Jing, Qi, and Shen as the 3 treasures of the human body. If you have too many desires and a chaotic lifestyle, these 3 treasures become depleted, leading to organ dysfunction, and even a healthy heart can develop problems. How to nourish them? Avoid staying up late, don't overwork yourself, and add some goji berries and Chinese yam to your diet to nourish your blood and qi. This will naturally stabilize your heart. Although aortic dissection and mitral valve prolapse seem different, in Tai Chi theory, they both stem from a heart-qi fire imbalance, a problem with the 5 elements. If the fire element keeps decreasing without replenishment, the heart's function gets disrupted. For example, with aortic dissection, high blood pressure combined with poor sleep causes excess heat to rise, putting too much pressure on the blood vessels, leading to tears. With mitral valve prolapse, the fire element is weak, causing the valve muscles to lose strength. Arrhythmias and slow heart rate are also related to qi deficiency, although each person's situation is unique. Learning standing meditation or zhanzhuang is ideal. It regulates qi. Just 15 minutes a day can stabilize your heart and smooth your qi. Besides Tai Chi, magnet therapy is also worth exploring. It's a very useful complementary therapy. Magnets can regulate your magnetic field, improve blood circulation, and ease the burden on your heart. How to use it? You can wear magnetic bracelets or necklaces, apply them to acupuncture points, or sleep on a magnetic pillow. It's simple and convenient. Some of my patients have reported better sleep and more stable blood pressure after using magnet therapy. Of course, it's not medicine, and the effects vary from person to person. But combined with other healthy lifestyle practices, it can improve blood and qi flow and reduce stress on the heart. After surgery, take it easy. Don't let your desires ruin your health. Emotionally, avoid arguments. Anger hurts the heart. As for sexual activity, take a break after surgery and wait for your doctor's approval. Don't overdo it when you resume. Also, avoid smoking alcohol, spicy and fried foods. Even if you have cravings, you need to resist. Your heart will thank you. Learn from the Taoists. Quiet your mind and your qi and blood will flow smoothly. Don't lift heavy objects and cough gently. Avoid straining yourself. In winter, dress warmly and protect yourself from the cold wind. If you're feeling down, talk to your family or find someone to confide in. Don't bottle it up. In short, although aortic dissection and mitral valve prolapse are different, post-surgery care for both involves stabilizing blood pressure and nourishing the heart. Sleep well, eat light, exercise gently, incorporate the TCM principles of Jing, Qi, and Shen. Practice the slow movements of Tai Chi. Try magnet therapy to regulate your magnetic field and manage your desires. By doing these things, you can gradually recover. A healthy heart leads to a happy life. Right? All right. That's all for today's Gold Medal Nursing. Please subscribe, like, and share this video. Leave a comment if you have any questions. See you next time.